guys, Jessica Willis with Willis Advisory and Insurance, and we're continuing our 28-day posting challenge here in February. Yesterday, we discussed maternity coverage, and today we are going to talk about when to add your newborn to your coverage. So you may not realize that there is a deadline when adding your baby to your coverage. If you miss it, you could be stuck with some big medical expenses. So let's go over how to add your newborn to your health insurance. When should you add a newborn to your health insurance? A newborn qualifies for a special open enrollment period. So normally you can only enroll or change your health insurance policy during open enrollment, but having a baby does qualify you for a life event, meaning you do get that special enrollment period. Timeframes to adding your newborn to your coverage. For employer-sponsored plans, typically that's 30 days after giving birth. ACA Marketplace, they'll give you up to 60 days to add your newborn to coverage. And then if you are on Medicaid or CHIP, you can apply at any time for that coverage. Pro tip, just start the process before the baby even arrives so you're not scrambling after the birth. Now, how to add a baby to your insurance plan. First step is you want to notify your insurance company of the new birth. Calling them directly or calling your HR department if it's an employer plan and letting them know that you want to add your newborn. They are going to require some documentation before they add the newborn onto the policy. The required documentation that they're looking for is going to be like the baby's birth certificate, wellness checkups, as well as the newborn's social security number. Now, if you didn't have any complications during birth and your newborn is perfectly healthy, adding them to your current policy should be simple. If the newborn comes out with any genetic mutations or had some difficulties, looking and reviewing a policy separate for just them may be our best option. You really want to make sure that you're getting the newborn the coverage that they need. And the last step is really just confirming when that coverage date starts. You can ask for the coverage of your baby to officially begin on a certain date or get it retroactive to the date of birth. Get proof of that coverage from your insurer in case of any billing issues. Even if you don't add the baby right away, your newborn may still be covered under the mother's insurance policy for at least the first 30 days, but it does vary by plan, so always check the fine print. That you want to consider when choosing a plan for your newborn is if that newborn had any complications. Just adding them onto your personal plan may not be the best option. You may have a pediatrician or specialist that's not in network for them, and you don't want to have any unexpected medical costs. A newborn to your policy may also increase your monthly premium. Now remember, you can apply for Medicaid or the CHIP program year-round. It is not limited to an open enrollment period. And if you have a private insurance, CHIP can also be an affordable backup for your children. My final tips for you is if you're currently expecting, start the process early for the birth if possible when it comes to choosing the insurance plan. Check your plan's deadlines on when you need to add the newborn. It could be 30 days for employer plans, 60 days for the ACA, or any time for Medicaid. Confirm the pediatricians are in network before selecting the plan. If you need help navigating these options or have further questions, book some one-on-one time with me at willis.care. And if you need help navigating these options or have further questions, book some one-on-one time with me at willis.care. Stay tuned tomorrow because we're going to be dropping a video talking about using a hospital for delivery or using an at-home birth with a midwife. Willis Talkin' Insurance on YouTube, Facebook, and TikTok. Thank you guys so much. See you tomorrow. Bye. Willis Talkin' Insurance on YouTube.